Many people are struggling with mental health issues, including substance use disorders. There are not enough psychiatrists out there. There are not enough people to help the folks who are struggling. We know that about 80% of antidepressants are prescribed by non-psychiatrists. We know that, and that's done in the primary care setting. So training those who are working in primary care settings with largely underserved patient populations helps increase the workforce. The train new trainer approach includes learning about the basics of diagnosing and treating common psychiatric conditions in the primary care setting. But the added component is teaching our learners how to teach others in the hallway, in the clinic, and also how do they give talks and presentations in their community as well, because we know that increases the workforce even further.
The TNT program is over 10 years old at this point. It has a proven track record of educating primary care clinicians in general psychiatry, and now added tracks in child and adolescent psychiatry and addiction medicine. This program aims to equip primary care providers as well as general psychiatrists with the knowledge and the foundation to truly integrate the screening, assessment, and treatment of substance use disorders in their clinical practice. General psychiatrists are identified as the experts in psychiatric mental health care, right? And a lot of people rightly recognize that substance use disorder is part of and should be integrated into holistic treatment of mental health to address co-occurring substance use disorder and psychiatric illness.
Primary Care Training and Education in Addiction Medicine, or PCTEAM, is a one-year-long clinical training program. And we kick it off with 2 in-person conferences each year. And then we have twice monthly 60-minute didactics, which are meant to not be intrusive to a clinician or a provider's workday. And then one of the things that really makes PCTEAM unique is that we have once monthly small group mentorship. And within those small groups of about 8 individuals, you have a faculty member who is board certified in addiction psych or addiction med. And so those faculty members are there to really facilitate the shared learning experience between the fellows and faculty. We definitely cover a variety of substance use disorders, from assessment and diagnosis to the actual treatment, medications, what behavioral therapies are available, recovery supports, how do you utilize those, how do you navigate different levels of care. We also work in some skills. So we teach skills around motivational interviewing. We do a lot of practice, a lot of role plays. We even have research using AI bots to role play motivational interviewing in the context of an actual clinician setting and patient appointment. And then we work on CBT, or cognitive behavioral therapy skills, to really help someone move forward in their recovery journey. And then when somebody graduates from PCTEAM, they're engaged in lifelong learning. So they have the opportunity to attend some of those alumni groups and watch some of the asynchronous material that we're constantly recording and pushing out for viewing through our Canva platform.
For me, I would say that when my patients came to me with mental health issues, of course, I'm the first point of contact, but when I take a social history from them, and there's the issue of drug use or abuse or substance use, reflecting now, there was a lot of lost opportunity to have intervened at the time, just because I didn't have the resources, just because I didn't really understand the neurobiology of addiction. This program was a blessing because empowering primary care providers to fill in this gap, to be able to meet this demand, because I have the resources, the tools to now do something.
Integration and bringing the holistic approach to the care of individuals is of critical importance, and it's how TNT and all 3 of the tracks have been built from the ground up. the recognition that we're not individuals that are separated from our biology and our psychology. We need to teach in that way, and then we need to equip healthcare professionals to always address individuals in that integrated manner. And our fellows, our alumni, with that new integrated approach, they're the connectors of their community and bringing those often siloed resources together for the betterment of their patients and for the community.
We work with various counties, we work with various states, countries, health plans, industry, and other academic institutions, so we can deliver this training to those who are dedicated to be working in underserved settings. So our learners, our alumni, and our faculty, and our staff, everyone, we have the same goal, and that is to provide care for those who need it the most. No question about it. That's where we're going. That's our mission with TNT.